Hello, my name is Verna Fitzpatrick, and I'm the Vice President of the Black Long-Term Care Executives. The Black Long-Term Care Executives Summer Youth Internship Program was started in 2021. The program provides high school juniors interested in healthcare careers with a unique experience to shadow healthcare workers in a skilled nursing facility. For 6 weeks during the summer, interns rotate to all departments and services of a facility. They learn directly from professionals not only about educational requirements for a given profession, but also what personal qualities are key to providing healthcare. We're talking about compassion, empathy, and respect. The internship will open their eyes and help them to learn more about themselves as they pursue a healthcare career. Following, you will hear reflections from 2024 interns. Thank you for your support.
My name is Eden James, and I attend Harts High School in Queens, New York. In the flyer that I received for the internship, it said that I will be working in a nursing home. And as someone who is very empathetic when it comes to working with people, I thought that this was an opportunity to further that knowledge to gain more experience. I am working at a veterans home, and in there's many different people on very different scales. Everybody attended some type of war, and within that, people are very prone to trauma and also diseases. So when it came to helping out and seeing, what everybody needed to feel better for themselves, I had found physical therapy, and during one of the weeks that we were scheduled to do, and during that, I found my liking and interest in physical therapy and thought that this could be something I could do long term. So while working in the home, there were residents that had to do specific exercises in order to get whatever they had going wrong fixed. So for example, some had their legs, they weren't working as well. So there's, simple exercises that they do to get back on that track. But sometimes the exercises were too much, or they were just focused on it too much to where they got tired, they had to keep stopping, and it was a lot on their bodies. So I thought that while helping them, I can distract them by asking questions such as, what branch did you work in, since it's a veterans home, as well as, do you have any kids, how's your wife, how are you feeling in this facility? Simple things like that made it easier for them to focus on it rather than the exercise itself. I feel like you did very well. I got a lot of compliments and people asking me to come back and help out. I feel very much empowered by working in this internship. I feel that the connections I made with people will help me long term, and with that I can make my experience working in healthcare better than what it is now.
My name is Tia Holmes. I attend Clara Barton High School of Health Occupational. The area I'm interested in studying is EMT, Emergency Medical Technician. Originally it was NA, but then I found out later on in the line, like I can't just sit still and not do anything. So I'm more into emergency medicine and wanting to be in action. What piqued my interest about this program is being able to see different aspects of the health occupational field, because I always wanted to be like a doctor or something that could like help other people. Like when I was little, I wanted to be a police officer just like my grandfather. Then I chose to be a doctor because I realized, the people around me are getting sick, so why not just help them? One rotation that I really enjoyed was social work, because I love talking, and that's my main way of making friends and connecting with people. I find that working in social work, it helps me connect with others. With the dialysis home, we're connecting with the elderly, so anytime I see them, I always ask, you have any comments, concerns, complaints, anything I should be worried about, anything you want me to report, anything you have to ask. And most of the times the residents do have something, so I'll go tell somebody else, the resident wants this, and I either help them out do it or I help get it to them. Social work is one of the majors I looked in when seeing for my college list. Actually, it was between that, either early childhood development, because I'm actually certified in that, so it was between that, EMT, and social work. I say some advantages is the people I get to meet, because it's not often that I meet nerdy people like me. So coming here, it's more of like, I'm meeting other nerdy kids like me that want to be in a medical profession, or if they want to be in a medical profession, it's just because they really enjoy doing this.
Hi, my name is Ebenezer, and I go to the Bronx High School of Science. I've always wanted to be a doctor. My friend told me that we needed an opportunity to get experience in the field that we wanted to go to. And I honestly didn't really know about nursing homes. So I was like, okay, so it's a good chance to get to know about nursing homes. I've been through most of the rotations so far, and I would say so far my favorite was the dietary, because the dietitian over there. She was really nice, and I really connected to her, and it was really fun to talk to her. And I also learned a lot. Also, I kind of had a little bit of background in the dietary field because my mom was a dietitian-ish, so I kind of knew a little bit going into that field. So I found it interesting that they had to relate to the speech therapist because they had to coordinate, for example, like the consistency of the food, like puree, the liquidized food versus solid food, because some people would die from swallowing. So they had to make sure that the food was able to like go down the throat, obviously, so that they wouldn't choke on it. I would like to be a doctor, but I also want to be able to connect to the community, and also I want to be able to help the older population. And the nursing home has exposed me to the older generation. I'm aware of their needs and how they differ from me. So it's an eye-opening experience to see how people live different lives than I do with limitations to their body. It also reinforced my desire to become a doctor because as I spoke to the staff, they told me that there is a big gap open in the medical field for people to come in and fill it. Thank you very much.
My name is Hanina and I attend Bedford Academy High School. I liked how the program talked about the nursing home and offering different categories, so like in nursing and rehab, and seeing how the different departments work together. Because like while I'm in the internship, I can see how each department fits together, and like when one department fails to do their job, all the other departments have to step back because they can't keep on going what they can do. So I liked how the program offers different shifts to the different departments, and also how it offers like a community kind of base where we can all meet together, discuss the differences between each of the nursing homes. I really enjoyed rehab because I liked seeing the differences between OT and PT, and also seeing the speech pathologist, because prior to going into the nursing home, it was painted to me that the speech pathologist just like focuses on speaking, but seeing her there and during like care plans and admissions, talking to the residents and performing tests to see whether or not they can swallow, and then being there during their lunchtime, giving them like ice cubes to make sure like it can help their swallowing. It was really interesting to see. I also like rehab because I really got close in contact with a lot of the residents, knowing them, how long they've been staying in the nursing home, why they're in rehab, why they're in the skilled nursing facility, and so it just made me really connect with a lot of the residents. Before starting the program, I was interested in becoming a OBGYN. But like during the program, I really started getting interested in like nursing, although it's like a different side of the spectrum. I liked how like the nurses in the nursing home had so many different jobs, and they were really important. So I'm also considering like nursing, or perhaps taking like starting off nursing and then shifting that, so that I can have like prerequisites and experience in nursing and then going and becoming an MD. I really like working with children, and especially when they're like smaller and premature. So, and also like just helping others in general. And my mom has always told me stories of like how wonderful her OBGYNs are, and like perhaps like one of the doctor, like when she was giving birth to me, because the doctor had so much of an impact, his wife had given birth to a baby girl named Hanina, so she named me after her. And so I found that they had a really good impact, and also like giving families the opportunity and help that have children is just something that I really like in their jobs. And also I feel like there's also a need for OBGYNs, and as like cultures grow, sometimes there's not enough women in the field. So I wanted to be like an individual who helps individuals who have said cultures that make it difficult for them to go to a male OBGYN rather than a female. Yeah. It has given me more foresight by showing me that I'm like ready for this field, because like seeing the residents being able to know that I can help them really pushed me and showed me that I can be a really good impact to the healthcare community, being that going into the nursing home showed me that I can help others more, that I'm actually supposed to be in this field. When I have some of the residents telling me, if you come by our rooms, make sure to stop and say hi, which I did yesterday. And one of the residents told one of her family members, it's the girl from physical therapy. So I really enjoyed being that I can make an impact, a positive impact in the healthcare community, and just that confirmed to me that I'm in the right place. Thank you.
Alicia Rousseau. I'm currently a rising senior in high school for medical professions. I've been here for 1 year. Yeah, so I came in 11th grade. What I help them understand is firstly to remember where they're from, to not let that go past, and to do the effort, and with the language barrier to do the most to for example, watch movies, speak in English, like do daily activities in English to help them have more knowledge of the language. And also, if they are failing in some classes, offer them help. When I was in 11th grade, because I didn't know much about all those things, but when I started talking with my guidance counselor, she told me about a program for the senior year that I could attend. It's like an introduction to nursing that could really help when you're going to prepare you when you're going to college. And she also proposed me that BLTCE program, which I'm in right now, and I'm really grateful for that because that has really helped me in different ways. The department that I enjoyed the most was definitely rehab, because at first I still want to be a nurse, an anesthetist, but when I went to rehab, I really fell in love with occupational therapy because I really like how the nurses take time to help people who maybe were living a normal life before, that lost that ability or were born with some type of disability, getting better and doing better in life. So I really like that. It was really one of my favorite rotations. Yeah, being able to see them help getting better, that really made me interested in this field. I will definitely do more research about that to see how I can combine occupational therapy with nursing, because it's something I really like. So I will look more into that and ask my guidance counselor and even the organizer of this program, because I know she knows a lot about this thing. This program, it really helped me because at first I knew I wanted to go to a career to help people because I like to help people, but I was unsure. I was wondering which one would be the best match for me. But in this program, being able to have first-hand experience with healthcare, it has really helped me make a choice and be certain of what I want to do with my future.
My name is Aaralyn. I'm 17 and I go to Health Opportunities High School. Oh, well, I mean, since I was a little girl, I did want to become a nurse. When I was little, I always said I wanted to work with babies. So I kind of stuck by that, and my aunt is also a nurse, so I kind of looked up to her. Like, when I was taking my human bio class and stuff, I always texted her, like, is this right? Is this question right? Because I don't want to get it wrong. But yeah, growing up, I wanted to be a postpartum nurse, but I don't know if I want to be a postpartum nurse or a prenatal nurse. I'm like stuck in between, but I for sure want to be a nurse. To be honest, I think going through like different type of like rotations, I wasn't really as active, but towards the end where my resident was leaving, she cried. So it made me very sentimental, the way that she was like, oh, like I won't see you anymore. Because she already had built like a connection with me, and she also told me like, you know, she doesn't really have people like at home. So when she was with me, it was like she had a visitor every day. So it did make me cry. I think that was my favorite part of this whole thing, to be honest. As soon as I walked in the room, I really felt the connection like straight away. Like, you know, she wasn't like one of those elderly who lays in bed every day. Like, she was active. Like, she got up, she was cleaning her room, and you know, she was like she was me and like an older person, you know. But yeah, she was so sweet. During rehab, I went to like different care plan meetings. Even though they were talking about the same things, certain like care plan meetings were like who's gonna get discharged or like, you know, little stuff like that. During rehab, I mean, some of the residents, they were like on bikes and they were, you know, exercising their arms. and like, you know, practicing how to move around again and stuff. I think that was my favorite part. It was heartwarming. It was like they were resetting or something, you know. It bettered my communication skills, definitely, because like I am shy, but it definitely made me talk more. It made me interact more. Thank you for having me.